So when we look at the performance of these assays, we have to consider the long-term performance, right? So when you look at a study, that's a snapshot of how the assay performed at that time, but we need to also evaluate, beyond that and look at how robust the assay is over time. We want to eventually have an assay, of course, that we can implement in clinical practice. So having the knowledge of how robust this assay performs over time, how reproducible that assay and how resistant that assay is to bias over time is going to be a very important consideration. Because as we establish cut points for interpretation and telling a patient, yes, you have amyloid positivity or you don't, we need to make sure that over time that data doesn't change, or that result doesn't change, and that what we call positive and negative remains the same over time. So that's, that will be, right now, a lot of these assays are being evaluated for research use. But then, the next step is to have them not only in clinical trials use, which some of them are being already used in clinical trials, but in clinical practice. And that's a big consideration. And then, just creating that awareness of how the various assays compare, how the various assays perform, because not the fact that they are recognizing the same molecule, the same biomarker, there is our work and others have shown that not all of them perform equally. So it is important that we know which assay is being used.